Hello, and welcome to Medical News Update. Today we are looking at a piece of research that frames the flu vaccine as more than a winter bug issue. For people with diabetes and for older adults in general, influenza can spill over into the heart and lungs in ways that lead to hospital admission. A quick bit of background, because it explains why this matters. Influenza infection does not just cause fever and cough. In the days after a confirmed flu infection, the risk of an acute heart attack rises sharply in some people, likely linked to inflammation, stress on the body, and a tendency to clot. That connection has been shown in large population studies, and it is one reason clinicians take vaccinations seriously in people at higher cardiovascular risk. The new study comes from Denmark and was published in JAMA Internal Medicine as a pre-specified secondary analysis of a large randomized trial called DANFLU 2. The question was straightforward. In adults aged 65 or older, does a high-dose inactivated influenza vaccine provide better protection than a standard dose vaccine? And does that differ for people with diabetes? The trial design is worth spelling out. Over 3 influenza seasons from 2022 to 2025, more than 332,000 adults aged 65 and above were randomly allocated 1-to-1 to receive either the high-dose inactivated vaccine or the standard dose version. The analysis included 43,881 people with diabetes, which is about 13% of the full trial population. Outcomes were measured using national health registries and focused on hospitalizations for respiratory and cardiovascular causes, as well as influenza-coded hospitalizations. Now to the results. Across the whole trial population, the high-dose vaccine was associated with fewer cardiorespiratory hospitalizations, fewer cardiovascular hospitalizations, and fewer influenza hospitalizations compared with the standard dose vaccine. When the researchers split the data by diabetes status, the size of the apparent benefit looked broadly similar in those with and without diabetes. For listeners who like numbers, the study reports relative vaccine effectiveness, which is basically the percent reduction in the outcome with high dose compared with standard dose. In participants with diabetes, the estimated relative vaccine effectiveness was 7.4% for cardiorespiratory hospitalization, 12.0% for cardiovascular hospitalization, and 41.6% for influenza hospitalization. The confidence intervals for the cardiovascular and cardiorespiratory outcomes cross zero, so those estimates should be read as suggestive rather than definitive. The influenza hospitalization signal was stronger and the confidence interval stayed above zero. One interesting detail is that duration of diabetes seemed to matter. People who had lived with diabetes for more than 5 years appeared to gain more protection against cardiorespiratory hospitalization, with an estimated relative vaccine effectiveness of 20.4%. In those with a shorter diabetes duration, that pattern was not seen. The authors are careful about this and describe the findings as exploratory. Still, it fits a clinical intuition that people with longer-standing diabetes often carry a heavier burden of vascular and cardiometabolic risk. What is high dose here? It is the same basic vaccine type, but with a higher antigen content, designed to provoke a stronger immune response in older immune systems. The JAMA paper notes that the high-dose product contains 4 times the antigen content of standard dose inactivated vaccine. How should this change practice? If you are 65 or older, this study supports the idea that choosing an enhanced flu vaccine can be a sensible default. In the US, a SIP already recommends that adults aged 65 and over preferentially receive one of 3 options when available: a high-dose inactivated vaccine, a recombinant vaccine, or an adjuvanted inactivated vaccine. If none is available, any age-appropriate flu vaccine should still be given rather than waiting. If you have diabetes and you are under 65, the message is simpler. Get the annual influenza vaccine. The exact product choice depends on your local guidance, supply, and your own health profile, but vaccination remains the most practical step to reduce the chance of severe influenza and its knock-on complications. A final caution. This was a pragmatic, open-label trial, and the outcomes were hospitalizations captured through registries rather than lab-confirmed infections in every case. That is not a flaw, but it means we should keep some humility about what the numbers can and cannot prove. Even so, the trial size, randomization, and real-world setting make it a useful piece of evidence for everyday decision-making. That's it for today's medical news update. If you want to read further, the primary source is the JAMA Internal Medicine Secondary Analysis of DanFlu 2, and the CDC's ACIP summary lays out current influenza vaccine recommendations for older adults.